Today is Workers' Memorial Day, and it's a very important day that we all gather in remembrance of our colleagues and friends of the workplace who have lost their lives, as well as that all those who have had very serious injuries in the workplace as well. So today is a time for all of us to take a moment out of our lives and remember all their families, their friends and their co-work colleagues as well. It's also a day that we also remind ourselves of the importance of health and safety at work. And that we constantly remember that we have to reconnect to that and recommit to that as well. We've seen everyone coming together during the times of COVID in very difficult circumstances, and many new workers found themselves on the front line, and they have provided a great service to the state, but at great personal risk to themselves and their own families as well. And I think it's a day to remember all them and to thank them for all their efforts. I do believe through all our social partners there is a very strong approach taken to health and safety. It's in our legislation, we'll constantly strengthen that, working with everybody, but it's important for all of us. It's a culture we want to achieve here, not just legislation, it's the culture of health and safety as well.
I am your mother,
father,
sister,
brother,
child,
partner,
lover.
friend. Today I plan to
Take a walk,
see a friend,
tell a joke,
give a smile,
pay a bill,
play a game,
take a ride,
kiss a cheek.
hug a child. I didn't plan to die today.
But I did. I plan to
Go to work,
build a bridge,
pave a road,
fix a pipe,
teach a class,
save a life,
paint a room,
write reports,
enter data,
work the line,
wire buildings,
walk the iron.
erect the steel.
I didn't plan to die today.
But I did.
Please think of me
Just once today.
when you fulfill your plans.
I am your mother,
Father,
sister,
brother,
child,
partner,
lover.
friend.
I didn't plan to die today.
But I did.
Ladies and gentlemen, colleagues and friends, it is an honour to speak to you today on International Workers' Memorial Day. Since the beginning of the outbreak, over 3 million people have died of COVID-19 globally. Over 4 million health workers have been infected, and thousands have died. Behind these numbers are mothers, fathers, children, partners, lovers and friends. Behind these numbers are stories of hope, fear, loss, grief, sacrifice, courage and remembrance. Over the past 15 months, we have not taken the time to remember the thousands of doctors, nurses, physios, occupational therapists, medical scientists and community health workers who have given us everything in the fight against COVID-19, even to the point of sacrificing their own lives. Let us take the time today to pause, to look back, to remember and share their stories, to thank them for their selflessness and admire their courage. Let us acknowledge and honour those who've supported, protected and cared for us. At WHO, we also remember the many frontline workers who have risked their lives in conflict-affected settings, sometimes even being directly targeted. In 2020, more than 320 incidents of attacks on healthcare were recorded from 16 countries. In total, the incidents have resulted in 213 deaths and 292 injuries of healthcare workers and patients. In 2021 alone, as of 23rd of April, we have received already reports of 50 deaths of health workers due to attacks, and over 90 have been injured. Health workers are often the brunt of an outbreak's impact, as they are the ones in direct contact with patients, often exposed to a higher risk of infection than the general population. Transmission can occur both in acute care and long-term facilities. The pandemic has laid bare the challenges and gaps in our health systems, which have amplified the risks to health workers all over the world. The pandemic has revealed the lack of critical equipment, supplies and resources, poor working conditions in hospitals and healthcare facilities, pre-existing workforce shortages, which have led to repurposing of staff and created gaps in other places. Frustrations about these gaps have triggered labour protests and strikes in approximately 84 countries. Almost 1/3 were related to the lack of personal protective equipment. Over 70 countries have amended their national health worker regulations in response. The unprecedented and unexpected burden on the healthcare system has in turn contributed to work-related stress, burnout, stigma, and mental health problems such as depression and anxiety. The care for infected family and friends has often been an additional source of strain. The pandemic has exposed multiple inequities in many countries, and health workers face increased risks of violence, accidents, stigma, illness, and death. On the other hand, data has indicated a steady but substantial decrease of health worker infections with COVID-19 since the beginning of the epidemic. This points to the fact that appropriate personal protective equipment, hand hygiene best practices, the implementation of universal masking policies in healthcare facilities, and adequate infection prevention and control training and education have borne fruit. The simple equation is that the protection and well-being of health workers reduces the spread of any disease and maintains the strength and service of the healthcare system. The Constitution of the World Health Organization states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. Therefore, we also take the right to health in the workplace very seriously. The prevention of SARS-CoV-2 infections in health workers requires an integrated approach that includes occupational health and safety and infection prevention and control, with adequate clinical staffing levels in healthcare facilities. Only this comprehensive approach will protect healthcare professionals in their work environment. Let's ensure that healthcare systems and facilities are supported with regards to the reduction of COVID-19 infections in health workers. Let's ensure that organisations providing healthcare guarantee sick leave policies for health workers that are non-punitive, not associated with any financial disincentives, confidential, flexible and consistent with public health guidance. Let's ensure that staff are aware of where and how they can access mental health and psychosocial services and facilitate access to such services. Let's ensure that good quality communication and information is provided to all staff and that workers rotate from higher stress to lower stress functions. In the coming months, workers from all around the world will face the next challenge, a safe, phased and responsible return to the workplace. We must caution against rushing into this transition with any false sense of security due to increased vaccine coverage. We have come a long way, but we have not reached the end of the tunnel yet. In November last year, the World Health Assembly elected to designate 2021 as the International Year of the Health and Care Worker. On this day, and during this year, I would like to take the opportunity to personally thank all health workers for their selfless and tireless contributions to our communities. You have risen to the challenge. Every day, you are saving lives. You have reached out and expanded your skills, your expertise, and the services that you provide. You are providing critical, professional, and also emotional support to families. And you have given stability and hope to our communities. We thank you. And we stand today and remember, thank and honour those who have lost their lives in the service of those who needed them most. Thank you.